A disease that once meant certain death can now be managed, and people can live long and healthy lives with modern medicine. I'm going to be talking about HIV and AIDS, and talking about the history of it, treatments, and also some myths and stigmas involved with it. First, I'll kind of define HIV and AIDS for you. HIV is human immunodeficiency virus, which causes AIDS, which is acquired immune deficiency syndrome. HIV attacks your immune system, so you basically can get, or you're very susceptible to any infection, which is why the common cold can kill someone with HIV. HIV is spread through intimate bodily fluids, so that means things like semen, vaginal fluids, blood, and then breast milk are what spreads it, and not things like saliva or tears. This is very important to know for both my colleagues here and then my counselor or my teacher to know, because pretty much anywhere you go, sometime in your life, someone might have HIV or AIDS, and it's important to know about this because both to protect yourself, because you don't want to get infected somehow, or you also don't want to discriminate against that person because they have to face that daily. So first I'm going to talk about the history of HIV and AIDS in the United States. In today's Truths for MTs by Ruth Werner 2017 from Massage and Bodywork, HIV and AIDS, the epidemic of HIV and AIDS started in 1981 when the CDC put out a report on 5 homosexual men in Los Angeles that were previously healthy but now had a rare case of pneumonia and various infections. In 1981, there were 270 cases of this unnamed disease and 121 died that year. 2 years later, in 1983, there was the first dedicated clinic and hospital ward for HIV and AIDS, which were filled immediately. 1,476 people died that year. In 1985, blood products were then tested for HIV because that was another main way that it was spreading. In 1986, it was finally named HIV, which is the name you know it today. In 1986, 16,908 people died of HIV. So that was a very brief history of HIV in the United States, and now I'm going to talk about some treatment. Warner also said that we can't chase the virus out of our immune system, but we can stop how it reproduces. Early treatments consisted of a schedule with lots of drugs, and the side effects were actually pretty bad. Sometimes they were even worse than the disease itself. An example of this was peripheral neuropathy, which basically is the death or damage of your nerves, and that causes lots of problems, and some other side effects include organ damage. Current treatments are much less severe, but are more effective, but do come with some side effects. And many people can manage just with 1 pill a day, and along with various medications for the various subtypes of HIV, exercise, a healthy diet, and good stress management, which all play a large role in how effective your immune system is, can lead people to have healthy lives. So I talked a little bit about treatments, both early and current treatments, and I'm going to talk about myths and stigma associated with HIV and AIDS now. Beverly McMillan, in her 2012 The Illustrated Atlas of the Human Body, McMillan explained how most HIV cases resulted from unsafe sex and the sharing of used needles. And Harold Jaffe also described the first notices were in MSM, meaning men who had sex with men, in Los Angeles and New York. This was in his 2008 Nature Immunology entry, The Early Days of the HIV and AIDS Epidemic in the USA. This initial emergence of HIV and AIDS in the gay community led to some discrimination against that community, especially back in the 80s and 90s, where some people called it the gay cancer before they really knew what exactly it was. Also, in good areas with good health care and adequate medical supplies, it's pretty easy to prevent and manage, but in underdeveloped areas, it can be pretty dangerous and it's pretty prevalent. As I said earlier, it spreads in intimate fluids, so that meaning blood, semen, vaginal fluids, and then breast milk. One of the myths going along with HIV and AIDS is it can spread easily and through like indirect contact, but that's not true. As I said earlier, it doesn't spread through saliva or tears, and it actually falls apart pretty quickly when outside of a host, which is why you can't get it from like doorknobs and stuff like that when people touch it. So as I said earlier, HIV is pretty preventable if you have the right supplies and knowledge, but in underdeveloped areas with lack of knowledge, it's pretty prevalent. And McMillan also said that 60 to 70% of global cases are in sub-Saharan Africa, where those very underdeveloped areas have very limited supplies and a lack of knowledge. This also led to some stigma against people living in those areas or people that were from those areas, because again, that's kind of where it's centered, and people kind of take that against them. So those are just a couple of the myths and stigmas associated with it, but there's many others that I'm not going to be going over with today. So today I informed you on the history of HIV and AIDS, the treatment options that were early and then current treatment, and then I also talked about some myths and stigmas associated with HIV. So now you have some of the knowledge that can help protect yourself from getting this disease, but it also allow you to not discriminate against people that do have it, and hopefully when you do meet someone in public or wherever you are, because you probably will someday, you can treat them nicely and protect yourself. Thank you.